So, hey guys, welcome to episode number 12. And today, this is actually part two of our session with Michelle Bolden, who's the owner of Home Helpers of North Atlanta. And if you didn't get a chance in the previous episode, she talked with us about her entrepreneurial journey. In this episode, part two, we want to talk more about how to plan, prepare, and honestly, just be able to know what questions to ask and navigate when it comes to getting care for an aging parent or loved one. Welcome to Black Wealthy and Wise, the number one podcast for helping Black families escape financial slavery and create financial freedom so you can live your best life and leave a legacy for your family. I'm your host, Alex Jones, and today I have the owner, Michelle Bolden of Home Helpers of North Atlanta. Again, we're going to talk more about what are some things that we should be looking at, thinking about, and preparing for in terms of getting home care for our loved ones. This is something that I've had to deal with in my own family. My mother was diagnosed with early onset dementia during the COVID pandemic. And my sister and I, my family and I, we just did not know what to do and what questions to ask. And I really, really wish we had someone like Michelle to answer those questions for us and to help us help guide us in this process. So thank you so much for being here. So I'm just gonna let you take it away and just kind of share with us, what do we do?
Right. Okay. Absolutely. And it is a challenge, and most of us are facing this. We're part of what's often called the sandwich generation. We're taking
Mm,
care of our parent, and we're also trying to raise our own family, our own children, right? And so at this age, we're deciding how can we help our parents who often want to stay in their own home, right?
mhm,
Or they
mhm.
want to live with us, which is even better sometimes. So, or you're caring for someone from a long distance. You're a long distance caregiver, but you're still a caregiver. And so one thing that we want to start with to be able to identify that you are a caregiver, because if we don't say who we are, then we miss the opportunity to get the support and the resources that we have.
Mm, okay.
For a long time, we always said, well, it's my responsibility to take care of auntie or whomever. It is, but we also need to make sure we call it what it is, because if you just do it continually, you'll get burnt out, right? And so there are so many resources around that can help you. And the first place we always recommend people start is to try to have a plan, right? And so if even you can begin to plan for yourself now, and wherever you are in your caregiver journey, it's not too late to plan, right? And so you're in the
Right.
midst of this, you don't know what to do, you can still plan. One of the resources that I really like is the AARP Plan Your Care Guide. You can go to aarp.org, plan your care, and there's about a booklet that's probably 30, 40 pages long that tells you exactly what you need to do from start to end, including self-care, which is so important to prevent that burnout, but to be able to give your loved one that quality care. So the planning care talks about the first component, which is getting a team. Again, so we go from just caregiving to having a care team. This is where we're trying to evolve right now, right? And so you can identify in your team who has what the best skill for certain things. So someone may be great at paying the bills, someone may be great at staying home and actually doing the care for your loved one. Someone is better at planning the appointment. So you want to identify what the roles are, and you also want to identify that financial component for them as well. Do they have long-term care insurance? Did they work for someone for 45 years and they have that plan? Because long-term care insurance could cover some of that in-home care that you're not having to pay out of pocket for. Um,
Okay.
and as well as the financial piece, do they have a policy in which they can actually take dollars out in order to be able just to plan for the care, not necessarily long-term care, but maybe there is some life insurance that they can draw from that they can help plan for your care as well. Is there
Okay.
a policy? Mhm.
I was going to say, oh, let me back up and make this point. Even we may be talking about someone who may not be an elderly person,
That's
right?
right.
This
Absolutely.
could be, first of all, someone who is just in need of long term care.
Right.
So it could be anyone of any age. First of
That's
all,
right. That's
okay.
right. So
So
it's for seniors and the disabled, in which we try to, yes.
yeah, okay,
Absolutely.
and so if you happen to be someone who is, I would say, like us, a child of a parent. So you would say for us, for ourselves, first of all,
Mhm.
what steps would you say we should do in order to really, make sure that we're not a burden for our
That's
children
right.
or
That's right.
yeah,
Um, Definitely, you want to speak with your financial planner about
gotcha.
things like long-term care insurance. You want to talk to your employer about benefits they may offer for the dependent care. So just as there's dependent care for children, there also is dependent care for adults, right? And so that may be available. You may have an opportunity from your employer to also have a policy that pays for an assistant living or you staying in your home as well. And so those are also options that are there. And so when you think about yourself, short term disability, long term disability, those often aren't very costly from an employer. Many times they'll pay for part of it and you pay for another part. Those are things that you can use. So once you run out of your vacation time, you have short term, then you have long term, and then you could a long term disability, and then you can use the long term care insurance. And so as much as you want to stack on all your benefits as long as possible to get everything out of it, right? And that's for us, right? And then as we prepare for our loved ones and we go back to the dependent care, if you're caring for a loved one in your home and they're dependent, there may be benefits where you can draw off of that dependent care for your adult parent, right? And so there are some opportunities there also.
Okay.
Mhm.
Um, all right. So as it relates to our parent or or our loved one, would you say one of the first things we have to kind of figure out is maybe the level of care they need?
Mhm.
Would you say that would be a good first start?
Yes, and that's why I mentioned the planning your care, because that
Okay.
allows for you to look at all of that, kind of who's able to help you, how much help do they need. And so when
Okay.
you talk about the level of care, are you able to take care of them in your home, or will they need to be in some type of facility? Is it doable
Yeah.
for you to be able to do that? And so we do have to honestly think about that, because sometimes we see our caregivers passing before the ones they're caring for because they haven't taken care of themselves, right?
Right.
And
Yeah.
so I know it's a hard decision, but we do have to be realistic about what we can do ourselves as well. So absolutely. And
Right.
mhm. And so if you're thinking about home care, there's questions that you may want to ask about licensing. What's your plan if someone is out or sick? How do you replace that person? You want to be really clear about things like that, right? And you should have the option to be able to, if you want, often they can have a conversation with the potential caregivers, what we call a meet and greet, to kind of have a conversation and see, is this person going to be a good fit for me, not because of the technical skills, but because of the personality as well, right?
Okay. Now, typically, is in home care, is it more expensive or less expensive typically than say an assisted living facility?
Well, it's going to depend on the level. I mean, you have some assisted living facilities that are just beautiful, I mean, these huge theaters, I mean, they're awesome. And so it just depends on the level that you decide upon, because home care it varies. It may be equal, sometimes a little less. It just depends on where you are and
Okay.
what
Okay.
facility you're looking at. Mhm. And it depends on from state to state as well. So, right. Now, there are some ways other than long-term care to pay for this, because often it is an out-of-pocket expense, meaning that you're self-paying yourself. But for veterans, there are benefits for veterans that they can pull off of some of their pension plans. There's a new benefit, I think it's called CCN, Community Care Network. And you can just reach out to your local VA clinic
Okay.
or facility and see about that benefit. Often states have Medicaid benefits that want to keep people in their homes. It's less costly to put them in a home than versus a nursing facility, and it's a better quality of life. So often Medicaid programs are available if you qualify. And then there are just some general state programs for adults that may be a benefit as well, regardless of your income.
Um, so when it comes to like Medicaid, Medicare, and let's just say, for instance, that um, that quite honestly, they didn't prepare for for any of this stuff, right? And and we find ourselves in a situation where our loved one needs assisted living or in home care. As it relates to Medicaid and being able to qualify, are there some things that you would say, okay, if you're healthy now, cool. Are there some things that we can do to kind of prepare to qualify for Medicaid if the
Well,
time arises?
right. So I don't necessarily to qualify for Medicaid because that's really most of those programs are based upon your actual income. And
Right.
so if your parent is living with you, for example, and they're only drawing Social Security and that's it, they don't have a retirement plan or anything, they may qualify for a Medicaid program because they're not looking at your income as the adult child. They're looking at the parent's income, right? And the
Gotcha.
program is specific to them. And so they may qualify. Now, I have someone I talk with often about Medicare who's a Medicare expert. I am not Medicare, Medicaid expert, but I would say reach out to CMS. Often Cigna, United Healthcare have their own Medicare Advantage plans that can give you that detail.
Okay.
But you can begin to prepare now for what happens at 65 when you do get Medicare.
Right.
Begin to look at the plans. What are your options? And so the organization that I mentioned before in the first episode is called Call for Caring. And that's what we provide information. Callforcaring.org. We have a podcast where it talks about the Medicare, Medicaid, legal challenges. That's one thing we underestimate as the proper legal documents when you're caring for someone, right? So all of those things are very key when we're trying to care for someone or prepare for ourselves as well.
And I certainly second that because prior to this whole little situation with COVID, my mom was living on her own. She lived by herself, and it was really sudden, um, and we literally found ourselves thrown in a situation where we really just did not know where to go, where to turn. We wound up um, deciding on an assisted living facility for her
Mhm.
because I lived out of state, and at the time, my sister um, had not retired just yet, and
Okay.
so she hated it. It
Mhm.
was it was not a good thing for her, and she wound up subsequently contracting COVID at the
Oh,
same time, and she
so
needed emergency surgery at the same time. So just a lot of things
sad.
happened all at once.
Right, right,
Um, but we got to a place where we said, hey, we're going to do whatever we can to take care of my mother.
that's
And
right.
fortunately, my sister retired, so she's the primary caregiver,
Mhm. Mhm.
and I go home, several times throughout the year to
Okay.
just to give them a break so
Right.
they can, and it gives me a time to, to reconnect with my mother, and
Yes.
I can share with her
Right.
as well,
Right.
and share the burden. So,
And
um,
that's just so important what you just said about giving your sister a break. And
yeah,
that whoever's the primary care, if you do it as a team, that they don't feel alone. And so for those caregivers, we so often stress self-care because we have to be able to do that. And I'm a long distance caregiver as well for my dad. So I go back and forth, or he comes here for a period of time. And I feel like that is my time to be able to spend with him and enjoy the time with him. Because sometimes when we're caring, we miss that connection as son and mother, daughter, and father. And so you want to make sure you're doing that as well, taking that time to still have that relationship.
Yeah. So, I would honestly say, the best thing that you can do for your loved ones in a situation where, you're thinking about your future because, looking at the statistics that they say roughly about 70% of people may need will likely need some type of assistance
Mhm,
as we get older.
mhm.
Um, and so the best thing that we can possibly do is begin to think about it, you know, plan for it if you can. And like you said, put those documents in place, whether it be a healthcare directive or some type of power of attorney or durable power of attorney, just to kind of help in preparation for that. Obviously, your life insurances or different types of long-term care, disability, those things really help out
Right.
as
And
well.
utilize the benefits that your employer is providing you as well, is really key. You want to
Yeah.
do that. Mhm.
So this is something that I highly recommend that uh, that we begin to think about, that we begin to talk about with our spouses, and to talk about with our parents and our loved ones as well. Because I think again, many times we don't have this conversation
That's right. Mhm.
until it's needed,
Right.
and then you have the stress and everything associated with trying to figure out, what
That's right.
needs to happen,
And
and,
the other part is that if you have a conversation now with them or yourself, then you're honoring your wish or their wishes. You're not guessing what they would want to do, and you don't get that bickering back and forth that mama would like this or she would like that, right? And so when they're involved, you honor their wishes, and that makes everybody happy.
yeah, yeah, I definitely, agree. Earlier, you mentioned, your podcast. Please, can you share that, with the audience again?
Sure, it's a call for caring on purpose. You can hear it on Up to Me Radio, Spotify, Apple, all the platforms is available, and it's called Call for Caring on Purpose. We have about 10 episodes out there, each focusing on a different area of caregiving. And so it's just full of great information. Make sure you have a pen and paper because we're just giving out great resources.
Awesome, awesome. And just in case my audience did not know that I am a licensed life insurance advisor. So if you'd like to discuss some of the different policies out there and how they might be able to help you take take care of some of these needs if they arise, I would certainly I'm here for you if you want to reach out to me as well. So, anything else that you would like to share in terms of words of advice or things that we should consider or do to take care of our loved ones or even ourselves?
I think we talked about it. It's just the planning is so important. And we talked about the insurance, what you can do in the future, but what you can do now is preventive measures, taking care of yourself, eating, drinking, water, all those things are really important. And also your mental health, right? Our mental health drives what we do. We have so much going on right now that everywhere we're just stressing the importance of mental health as well, because it does affect your physical being and also your spiritual being as well. So, preventive measures are great for yourself and your parents. And really, this conversation is hard to have about, advanced directives, a living will, and estate. But it's so important that we have that because that allows for us to be able to plan. And estate does not mean that you have like a mansion, it's just protects you in order to for you to be able to plan what's going to happen after you leave. And the courts doesn't take over for you, but you're able to stay in control even though you're not here. And so all those things are important: medical, legal, financial, and part of that planning for caregiver journey for yourself and your loved one.
I'm so glad that you shared that. and it's such an important part of it.
Mhm.
And it's something that we're all going to deal with, with these things in some shape or form.
That's right.
And like you said, the better you can plan and prepare and prevent things now, the better things are going to be for yourself and for your loved ones as well. So
Absolutely.
awesome. Well, thank you so much for sharing that bit of information with us. And again, if you could share your contact information so the audience can reach out if they need you in Atlanta or elsewhere.
Sure. So for our caregiver information, that's callforcaring.org. There's plenty of information out there to help you for your caregiver journey. If you're looking for personal and companion care, we're Home Helpers of North Atlanta. homehelpershomecare.com/in-Atlanta.
Awesome, awesome. Well, Michelle, thank you so much for sharing with us your entrepreneurial journey. If you didn't hear part one, please go back and take a listen to that. And if you have any questions, you are definitely encouraged to reach out to her as well. So, thank you so much for sharing with us, and we'll see you next time.
All right, thank you.